Hi, I'm Jason Bradley from Bodyworks Physiotherapy in Newcastle. The next injury that we're looking at is low back pain related to cycling. So low back pain is a really common condition and it affects about 80% of people throughout their life. And the pain can be very varied and different between people, just as much as the structures involved can be different. There's a large number of structures in the lower back, including small facet joints, intervertebral discs, which everyone has always heard of a slip disc. There's spinal nerves, muscles, ligaments between those joints. So there's lots of different things that can be put under stress, can get injured or can get torn, or just basically irritated. So there's a few common things that we usually see. We can either see pain right across the lower back, more on one side than the other. It can be shooting down the leg, most commonly down the back of the leg into the glutes and the hamstrings, sometimes as far down into the toes. But it can also come around into the front of the hip or into even the stomach. So when we're looking at low back pain, we want to screen to basically pick up whether we've got any risk factors for developing low back pain as part of our exercise program. So this is a pretty easy screen. So the first thing we're going to do is look at the range of motion in our back. So all you need is to lay down on the ground, hands underneath your shoulders, and push up. Ideally, you should be able to push up till your arms are straight and your hips are still on the bed. If you've got tight lower back, you'll find you get to about this point sometimes and you just can't get any further without lifting up through the hips. Our next screening test is a hamstring range. Laying on our back, one leg up to 90 degrees, and then slowly extend the leg. Now ideally for men we want to get to at least 80 degrees, which you can see I sort of struggle with a little bit there, so my hamstrings are a little bit tight. For ladies we say 80 to 90 or even 100 is more normal, so that they can pull their leg back further and still get that leg up straight. Our next screening test is we're looking at our core control. So the core is the muscles deep underneath our six-pack and our obliques that help control the spine in its positions and movement when we're exercising. And it also works with the pelvic floor. So we're going to lay on our back, hands on our hips, and slowly lift one leg. And then the other. What we're looking for with this is that our hips stay nice and level and nice and even on the bed. If you've got a weak core, what you'll notice is that as you lift one leg, the other hip will raise up, and when you lift the other leg, the other one will. So this is a quick, easy test. It's not the most in-depth core test, but it's a nice easy one for you to start doing at home. So how do we go about preventing low back pain? Well, first up, we want to increase the range of motion in our spine and the muscles that have impacts upon our spine. So as with the screening test, we can also use that as a preventative stretch. So laying on the tummy, pushing up, hold for a second, and then come back down. The next one's often called child's pose. So we're coming up on all fours, knees wide, feet together, and coming back. And this is a nice way to do bending through the spine, but it's fairly unloaded and you're not weighting up the spine like you do if you're bending forward while standing. Our next one is rotation through the lower back. Now there's two levels to this. Starting up with the legs bent, gently roll them side to side. A more advanced option is to straighten one leg, bend the other one, take it across with the hand, and then your other hand goes out to the side and look to that hand. As I said, this is a more advanced option. So if you're not feeling a stretch through the first one, you can take it up to this. You'll also feel stretching in through the glutes or your bottom and right up through that back, a little bit into the chest as well. Your next two stretches are your hamstring and hip flexor stretches, which are important. For our hamstring stretch, there's a wide range, but a good one is to get in a kneeling position and gently lean forward so you feel a stretch through here. You'll note that I've got my toe pointed out. When we're doing a hamstring stretch, if we bring our toe up, we'll often feel the tension go right down through the calf. This often is a nerve stretch and we don't really want to maintain that for long periods of time. We want to focus on the muscle part of the stretch, so we just let the foot relax forward. The next one is our hip flexor stretch, which is just kneeling and leaning forward. making sure we get a good stretch in through this front section of the hip. For our other preventative stuff, we look at core strengthening exercises. 3 basic ones that you can do at home. Laying on your back, fingers just above the hips, and gently drawing your belly button down or squeezing up like you're trying to stop yourself peeing so you can feel your tummy activate. It should be a really nice gentle contraction. It shouldn't look like you're straining to do a sit-up. It's just really nice and gentle. From that point, we then lift one leg at a time, keeping the hips nice and controlled. Your next exercise would be a glute bridge, like we discussed in the anterior knee pain tutorial. So tummy down, squeezing the glutes, and coming up into that position. Feeling it mostly in the glutes and the tummy, not too much in the lower back, nothing in the hamstrings, so you don't want to be cramping or tightening up in the hamstrings. The last preventative exercise is your pointer. So rolling onto all fours, hands underneath the shoulders, knees underneath the hips. We want to get between a neutral spine, so we don't want to be rounded fully up or overly rounded down. We want to have something just about in between. Once again, gently drawing up through the belly button and then extending the opposite arm to leg, keeping the back nice and still. Imagining that your fingers and toes are being drawn out by a piece of string. So think about nice and long, not necessarily really high. So give those stretches and exercises a try to help prevent lower back pain.